So, sir, this is what you should be taking for 7 days.
Okay, Doc.
Have your erections been disappointing when it counts? Good day, everyone. Today, I will be talking about the drug tadalafil. The treatment of erectile dysfunction, or ED, was revolutionized with the development of a class of drugs known as phosphodiesterase inhibitors. The newest and most versatile in the clinical armamentarium for the treatment of ED is tadalafil. Tadalafil is a drug that is used for erectile dysfunction among men over 18 years of age. As a phosphodiesterase inhibitor, it works similarly as sildenafil that is found in Viagra. It increases the chemicals released into the penis during sexual arousal, thereby inducing smooth muscle relaxation and increasing blood flow to the penis for erection. Take note, however, that it only assists in erection. Sexual stimulation is needed for it to work. So, how is it different from other products like Viagra? Tadalafil works within 20 to 30 minutes after taking the medication, while sildenafil or Viagra starts taking effect within 30 to 60 minutes. Compared to sildenafil, which lasts only up to 4 hours, tadalafil works longer, for up to 36 hours, earning the name the weekend pill. With an effectiveness lasting up to 36 hours, it allows patients to choose when to have sex without the need to time it. And we're only getting started. The search for the treatment of one of the most disappointing diseases of men was put to an end with the introduction of sildenafil in 1998. It was marketed by Pfizer under the brand name we all know, Viagra. The addition of other phosphodiesterase inhibitors to the market broadened the landscape of erectile dysfunction treatment and solidified this class of drugs as a safe and effective first-line treatment. In 2008, Eli Lilly added the latest innovation, tadalafil, under the brand name Cialis. Consequently, FDA approved this drug for once daily dosing for the management of erectile dysfunction. In 2009, tadalafil was approved for the treatment of pulmonary hypertension or high blood pressure in the lungs. In 2011, FDA approved another indication of this drug in the treatment of benign prostatic hyperplasia or the enlargement of the prostate, which often coexists with ED. It seems like the penis, prostate, and lungs aren't really that far from each other. Eli Lilly had patent on tadalafil until 2017, and now it is being sold as generics across the globe with an unbridled acceptance and newfound candor from the general public. So, how should you take tadalafil? It is important to take this drug as prescribed by your doctor. You should take 10 milligrams once daily, at least 30 minutes before sex. But it can be increased to 20 milligrams or decreased to 5 milligrams once a day, depending on your response and tolerability. Remember, do not take it more than once a day. Swallow your tablets whole with water, and it can be taken with or without food. A missed dose can be taken once remembered, but must not be doubled. So, are there side effects to tadalafil? This drug is well tolerated, but some may experience side effects, especially those who take it at higher doses. Headache and indigestion are the most frequent symptoms, occurring in about 12% of men who take the drug. So these symptoms are followed by back pain,
My back! Oh, my back!
stuffy or runny nose, and flushing. Note, however, that these side effects are mild to moderate and they decrease in frequency with continued treatment. Serious side effects may occur but are rare, occurring in less than 1 in 1,000 people or 0.001%. Urgent medical care should be sought when you experience any of the following symptoms: an erection that is painful and lasts for more than 4 hours, or what we call priapism, sudden decrease in vision,
Oh, hell no!
sudden decrease in hearing, sometimes accompanied by ringing in the ears,
Can you repeat that? I had a marshmallow in my ear.
an allergic reaction, and chest pain during and after sex. So the question is, should you be taking this drug? Just to be clear, tadalafil is not suitable for everyone. Remember, if you are below 18 years old, are allergic to tadalafil or any of its ingredients, are taking drugs that cause vasodilation like nitrates and the recreational drugs poppers, are taking riociguat medicine for the treatment of arterial blood pressure, have a history of heart attack in the last 90 days or heart failure, have a history of stroke in the last 6 months, have chest pain during sexual activity, have uncontrolled hypertension, have a history of vision loss due to poor circulation to the eyes, and of course, if you are a woman, this drug may not be for you. Tell your doctor if you have any of these conditions. So what else should you tell your doctor? Tell your doctor that you take tadalafil. If you need emergency care for a heart problem, it will be important for your healthcare provider to know when you last took this drug. Inform your doctor if you have liver or kidney problems, because metabolism and elimination of this drug may be affected by these conditions. Always discuss with your healthcare provider all the medications you are taking, including prescription-only drugs, over-the-counter drugs, herbals, and supplements to avoid any drug interaction. So can you take this drug with other treatments for erectile dysfunction? The safety and effectiveness of tadalafil when used with other treatments has not been studied. Combined use could lead to additional lowering of blood pressure, possibly to unsafe levels. Therefore, the use of such treatments in combination with tadalafil is not recommended. So are there any food or drinks that you need to avoid when you're taking this drug? Having a bottle of beer or a glass of wine is unlikely to affect the drug. But drinking lots of alcohol can make it more difficult to get an erection.
Please, no! No!
It is also not recommended to consume large amounts of grapefruit juice with tadalafil because it can increase side effects. So, what do you think would keep your penis from being a disappointment? Oral sex? Anal sex? Vaginal sex? Or maybe tadalafil? Well, it's for you to find out.
Oh man, I feel like wow.
So remember, good doctor, free online consultation.